All right, here we go.
My name is Reverend Dr. Brenda J. Gregg.
My name is Ken Turnbull.
I'm Dr. Imran Kadir.
My name is Barbara Burns.
I'm Mark Masterson.
My name is Jarrell Gilliam.
My name is Diana Bucco.
My name is Blaine Workman.
My name is Dr. Daphne Kurgis.
I am actually the senior pastor here at Destiny of Faith.
I'm the community pastor here at Allegheny Center Alliance Church.
I'm one of the medicine physicians at Allegheny General Hospital, but also the president of Allegheny General Hospital.
And you're in my store, Sweet Time, on East Ohio Street.
And I'm the executive director of the Neighborhood Community Development Fund.
I'm the executive director of Light of Life Rescue Mission.
I am the director of Project Destiny.
I'm the associate pastor here at Allegheny Center Alliance Church.
And I'm the president of the Buell Foundation.
The Neighborhood Community Development Fund is a nonprofit loan fund, and we finance small businesses. We work with community assets like the Christian Health Center.
When we do our kind of work, we are working with people who have many needs. And so we need partners to come alongside.
I play the role as funder, so we give grants when necessary to help build the capacity of the Northside Christian Health Clinic.
Project Destiny is a safe place for youths, for families, for children, for all to come.
As the president of Allegheny General Hospital, I found it important to connect bridges between different community organizations, people, and our patients.
I opened this store 22 years ago to be a part of the positive transition of the business district.
We need to be partnering in ways that we are not a healthcare provider. Northside Christian Health Center is the healthcare provider.
We aligned from the very beginning with Northside Christian Health Center. Two of the original three founding doctors were members of ACAC. It's a way of touching people holistically in our community with the love of Jesus. And we can do that not just through spiritual interaction, but also through meeting needs emotionally and physically as well. And so Northside Christian Health Center fit right into that.
Well, first of all, we help families. And a lot of times we're helping the same families. And so there are certain things that the Northside Christian Health Center can do. And I think there are things that we can do.
There are probably a million different ways to be a good community partner. You can be a community partner by donating to a good cause, like Northside Christian Health Clinic. We talk about being a good community member as this idea of giving and getting. At any time in all of our lives, we need to get help or get something, and at any time in our lives, we have the opportunity to give. If everybody made a commitment to giving or getting when they needed it or when they were able to, then we would all be great community members because we would see opportunity and we would take advantage of it by giving.
We're really pleased that we had a health center, a community health center, and that I don't think people realize how important that is. If people are healthy, they're going to live happier lives.
They do it in a way that not only looks at physical health, but at the whole person. And as we all know, physical health isn't the only thing. You need basic needs in addition to physical health. And the Northside Christian Health Clinic gets that.
It's holistic in so many ways. It doesn't just address one person in the household, but they address everyone in the household, which is great. And then also the concern around whatever services they are not able to provide families, they are connected through partnership with Project Destiny, who provides a plethora of community health related initiatives, and Light of Life with housing. So there's definitely a strong need for the collaboration, and I think people can tap into the Northside Christian Health Center to be able to get whatever service and support they can get within the Northside setting.
People don't necessarily want all handouts. They want a hand up. And I think us working together, that can help.
So we need people to invest in Northside Christian Health Clinic because folks need to be healthy. When folks are healthy, they can participate constructively in their community, in their neighborhood, and in doing that, they can ensure that a community is good for everyone. And we all will live better when everybody is living well.
One of the missions for the center is preventative care. So essentially, the center plays a crucial role in keeping the community healthy.
You like to be able to say there's an alternative for you, and hopefully they seek help rather than run from it. And so the Christian Health Center can't get any closer, more convenient, more accessible to people, regardless of where they come from.
For us, it's all about community, because what I say the opposite of addiction or the opposite of homelessness is community. So it's about bringing people in. So what we want to do with every service that we have is have the opportunity for relational connection. And so that's what Northside Christian Health Center is able to do. They're able to provide that one-on-one touch, that warm handoff.
So in the North Side today, 20% of the population is living in poverty and 30% are working poor. So when you think about that, half the population of the North Side is working really hard just to get by. Think about what it's like to have access to quality, affordable health care.
The first thing the doctor did was introduce herself, and then she also invited us for prayer, and I thought that was phenomenal. Me being a Christian, as well as the client that I was with, she enjoyed it. It opened up doors for trust. It opened up doors for a candid, transparent relationship and discussion.
It means if you have a need, you go to somebody you know or someone who has the time to sit and talk and pray with you, who you have an ongoing relationship with.
Well, our mission here is to follow Jesus in diverse community and to bring help, hope, and healing to people in this community in Jesus' name. And Northside Christian Health Center obviously does that very well, and particularly in the area of the physical needs that people have, the chronic health needs that they have. Many of them that have very few alternatives to address those health needs, if not for a place like Northside Christian Health Center.
The center is deeply rooted in the community. The people and the patients trust the center to provide great care and seek care when they really need it.
We know that those who are frequent flyers of emergency departments, when they get comprehensive wraparound support and they feel connected to a healthcare provider, they will not go to the emergency department. So that saves costs. And so for the residents of the North Side, trust occurs through the Northside Christian Health Clinic. And that's really important.
And so when you treat people with respect and dignity, which they do there, I think you serve people well. And not everybody has serious health issues, but starting them in a habit of seeing a doctor, taking their medicines properly. I see every day on this street where people have not been well served by society, where they have no access to health care.
When we do it together, we can help. We can help children and their families. We can help them stay together. We can help them fish for their own fish. We can help them learn. We can help them play in a community that they love. And I think that's what community is all about.
I am the Buell Foundation.
I'm Allegheny Center Alliance Church.
I am Destiny of Faith.
Sweet Time.
I am Allegheny Center Alliance Church.
I am Neighborhood Community Development Fund.
I am Project Destiny.
I'm Allegheny Health Network. I'm Allegheny General Hospital.
I am Light of Life Rescue Mission.
And I am
I am
the Northside
Northside Christian.
The Northside Christian Health Center. And together,
And together, we are
And we are
the Northside community.